When we talk about wellness, we mean more than whether or not someone has access to doctors and hospitals. Access to healthcare is important, but wellness is about more than that. It's about nutrition and income. It's about education and where you live. Here in Kansas, many people struggle with access to safe housing, nutritious food, transportation, and other social needs. And that struggle has a very real impact, not just on individual health, but also on the cost and effectiveness of healthcare for everyone. Brett Martin of the United Way of Kaw Valley witnesses this struggle firsthand. He works to address the factors that are called the social determinants of health.
So when you think about that little bit of time that you might spend with a doctor or physician, that's certainly one part of your health, but the social determinants of health are all of those things that affect your health that are outside the doctor's office.
To help bridge the gaps in communication and coordination, healthcare and social service organizations across the state have come together to form the Kansas Community Network using the WellSky Social Care Coordination platform.
The Kansas Community Network is healthcare organizations and social service organizations working together to be able to identify social needs and make referrals to the organizations that have the capacity and the skills to address those needs. And what it does is it brings systems that have historically not worked together and brings them all together working towards the same goal of improving health.
This network serves communities across the state of Kansas and is comprised of organizations including Blue Cross Blue Shield of Kansas, Stormont Vale Health, United Way of Kaw Valley, Community Action, and healthcare technology leader WellSky. So how are these community network partnerships improving the level of service they bring to their members?
Community Action is part of the Kansas Community Network because we recognize that the work cannot be done by a singular agency. It takes community partners to work together to help people succeed. The network provides a means of communicating between the different community organizations and agencies so that we're meeting the needs of the client holistically. We're meeting all of their needs as well as meeting the needs of the entire family.
I think the Kansas Community Network provides an opportunity for us to do our work differently. And in order to do our work differently, we have to think differently. This provides a chance for us to leverage resources and relationships in the community without duplicating those efforts on our own, right? So it doesn't mean that a hospital system has to hire more social workers. It means they need to develop relationships with community-based organizations to be able to help meet those needs out in the community. In the same way, it also means that community-based organizations don't have to build clinics on site for their particular services. So it's not about duplication, it's about coordination, it's about collaboration.
One benefit members in the community have as part of the Kansas Community Network is the easy-to-use platform that people use to locate the resources they need. It's called the Community Access Platform, and it's available on desktop and mobile devices. In just seconds, individuals can receive a list of resources that meet their social needs based on their zip code. Here's how it works. Individuals can go to the Community Access Platform. They search for services or programs that can provide the appropriate assistance. They enter a preferred distance and zip code for a listing of local services. Simply select an organization and reach out about their services. The Kansas Community Network helps organizations improve the coordination and care to the members of the community. To learn more about how your organization can be part of this transformative opportunity, go to the link you see on your screen. Because together, we can help realize care's potential.